Hi, I am Dr. Agyaram and I will tell about URTI, upper respiratory tract infections, which is very common in children and young age and affect to all the ages. And URTI, the part which includes nose, sinus, larynx and pharynx. So commonly in general nose and throat. That's why we call in general viral throat infections or throat infections. Sometimes due to inflammations there is a swelling in throat or neck and infections in nose or sinus which cause URTI, and it is self-limited disease, usually cured within 3 to 5 days or a week. So people want to know why this URTI or throat infections occurring and what the reason here, what the cause here. So usually I have seen the cause like infections, so viral and bacterial. So most of the times it's viral infections only, like rhinovirus, coronavirus, and other bacterial infections like streptococcus, and sexual active patients like gonorrhea, syphilis, and HIV, and common cold. And one more thing you have observed this, when there is a rainy season or cold weather or like a traveling history, and allergy like smoke allergy, climate allergy, dust allergy, and sometimes people will take cold items like ice cream or cold drinks or some freeze items, and this viral infection is spread very fast through one person to another persons, or from children to children, like they are in school or playing area, they come too close, and this is spreading very fast. And what are the symptoms here, how you what you feel in viral throat infections? So fever, and sometimes fever with chills, throat pain, difficulty in swallowing, throat irritations, nasal congestions, running nose, sneezing. You will see a frontal headache because of sinus issue. You will feel this eyes pain and this frontal headache, cough, headache, and sometimes body pains. And I have seen some patients because sometimes they are, because of irritations throat, they are coughing forcefully. They might get some blood drop in cough. So don't worry, this is throat infections. Because of coughing forcefully, there is a scratches inside throat, so that come with blood. And while examinations, what you will do, how you will evaluate and how you will examine. So you can examine nose, like there will be a swelling or polyp which is causing congestions, and you can see with torch in throat, you can see some small pimples or redness in throat area which indicates infections. For the treatment here, so as I told, it is a self-limited disease. It will cure within 3 to 5 days. A patients will take a treatment. So symptomatic treatment required. So if it is like a cold, give anti-cold medicines. If fever, give antibiotics. And for pain, NSAID. Do hot water gargling, or you can do betadine mouth gargling. And URTI is not required antibiotic most of times, but when there is a severe infections, while examinations, you can add short term of antibiotics, which is very helpful. And during treatment, like 3 to 5 days avoid cold items, and avoid smoke area like dust area, and use hot water gargling or betadine gargling, and try to take kashaya and some hot water, and frequently ask patient to wash hand, and while coughing or sneezing use kerchief, so it will prevent not to spread other. And it's very important to see and share this video. Thank you.